Thank you everyone for tuning in to watch GI Research on the Road. We are here at the James W. Freshman Conference in Chicago. This is the last day, and we're joined here with Emily Holler, who is a registered dietitian at Michigan University. Thank you so much for joining us today.
Thank you, and hello. Happy to be here.
Yeah, so actually today we're going to speak a little bit about how to incorporate a registered dietitian in with your appointments with the gastroenterologist, because Emily will share with us some of the importance of having that registered dietitian and creating a team and a village really with your gastroenterologist. So we're just really excited to hear about it and learn a little bit more about what a dietitian does and how can we make a well-rounded plan options for the patient.
Yeah.
So we're going to just jump right into question and answers. So Emily, what is a dietitian, and can you explain to us a little bit about why someone might schedule an appointment with you?
Yeah, so that's a really good question and a really good place to start. So registered dietitians, short and sweet, are trained and credentialed food and nutrition experts. So all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. And so to become a registered dietitian, one has to complete a minimum of a bachelor's degree in nutrition science. And that's actually going to change in 2024, where all dietitians are going to be required to have a master's or a graduate degree. But currently it's a minimum of a bachelor's degree, 1,200 hours of supervised practice, which is a dietetic internship. Then we're able to sit for a nationally accredited exam. And once we've passed said exam, we then have the RD credential. So that's what that means, a registered dietitian. And then we have to maintain ongoing nutrition education credits. Coming to the Freston this weekend is a part of that. So, we're constantly, we're held accountable to stay up to date, to provide evidence-based nutrition therapy. And so why someone might schedule an appointment, dietitians can wear a lot of different hats, and so dietitians can work in a lot of different settings. So they could work in food service or in the community, in nursing homes, in the hospital, in an outpatient setting, in research, in private practice. But I think pertinent to this discussion is, GI dietitians or a dietitian who can help patients with gastrointestinal disorders.
Right.
So patients or people, individuals with chronic health diseases might want to schedule an appointment with a dietitian to help them better manage that. Certain, athletes will schedule an appointment with a dietitian to help with that. So it kind of depends on the person and their needs, but the goal is to get evidence-based nutrition therapy that's individualized to a specific person to help you with your specific needs.
Yeah, and I think you really went into detail about the background of how to be a qualified registered dietitian and really why people would want to schedule an appointment. That is not just one really main cause that people schedule an appointment with you, but its main goal is to make sure that there's a plan that is tailored to the needs of that patient and why they're requesting an appointment.
Yeah, absolutely.
Yeah, so that's really good information. So also, for people who are living with GI disorders, like that's what we're here for this meeting, what might be the benefit for them seeking nutritional support from a dietitian?
Yeah, so and that's what I do. That's my current role or my current setting, and it's all about optimizing a person's nutrition status, nutrition health, while improving GI symptoms. So a lot of my patients have symptoms with food. So it's more about expanding their diet, looking for triggers if they have any, or identifying triggers. We can manage some, chronic GI disorders like celiac disease or eosinophilic esophagitis with specific dietary therapies, such as a gluten-free diet or a 6-food elimination diet, which we heard about yesterday. So, there's a lot, but generally, in a nutshell, it's about improving someone's nutrition status and improving symptoms. And also, yes, food is fuel for our body, and we need to eat to live, or we need to get nutrition through some form, whether it's food or nutrition support, but it's also so much more than that. So there's a lot of food fear and anxiety around eating because GI symptoms are quite motivating, right? If you don't feel good, you might not want to eat, which I think we're also going to be talking about. So, a lot of times we work with that. We try to get patients to a better place in regards to having a better relationship with food.
Right, so along with kind of sort of what you said about like if you're not feeling good, you don't want to eat. So what type of symptoms, GI symptoms, may be alleviated due to making dietary changes for some patients?
Yeah, so a lot of them, right?
Yeah.
So bloating, excessive gas, distension, abdominal pain, cramping, nausea, vomiting, constipation, diarrhea, all of those symptoms can be improved with diet.
Yeah.
So there's a lot of different things that can be done. And sometimes people have, I mean, it's rare do we have just one symptom. A lot of times we have a cluster of symptoms.
Mm-hmm.
So types of diets or even just the way that we eat, the composition of foods can really make a difference to our overall symptoms.
Right, and I think that's also why it's so important, because your gastroenterologist, he can tell you a little bit about how to get rid of some of those symptoms, but I think really digging deep into a dietary change, that's where the registered dietitian comes into play in helping the patient really understand some of their diet changes that can be made to help with that with those symptoms.
Absolutely. And even if it's not 100% too, I always try to realistically manage expectations. Sometimes changing something in our diet can completely eliminate a symptom, but not always. So we might only get 50% better within a certain symptom or 85%, but I mean, as long as we're moving in the right direction and then collaborating with other healthcare members to really, optimize this person's overall status. So that's just something also I think about.
Yeah, and I know today during the meeting too, I thought it was super cool, the slide that you put up, and we put it on Twitter also, but it was a slide about basically sharing the information about some of the GI disorders that respond best to dietary changes. So can you explain that a little bit for the patients?
Yes, so check out my slide on Twitter, on IFFGD's Twitter. But I mean, just some of the ones coming to top of mind, of course, celiac disease, right? Right now, the #1 treatment we heard this morning is following a gluten-free diet. Eosinophilic esophagitis, or EOE, we heard about yesterday. Again, we can do a food elimination diet, whether it's a 4-food elimination diet or 6-food elimination diet, to identify specific food allergens or triggers that cause eosinophils to migrate to the esophagus. IBS, I mean, I feel like the FODMAP diet is super popular right now, and if we look across studies, anywhere from 50 to 75% of people who have irritable bowel syndrome will respond to a diet low FODMAP. So that can be effective for managing symptoms. Gastroparesis for sure, by changing the types of meal sizes and the composition of foods, GERD, gastroesophageal reflux disease. And there's a lot, high ostomy outputs, which we heard from Carol Reese-Parrish yesterday. It was such a fun presentation to listen to. So I guess I would argue that there's not very many GI diseases that couldn't benefit from some degree of nutrition.
Yeah, and I think that's really good to understand, because I think the slide had like 15 different disorders, but still it's a variety of disorders that can benefit from seeking help from or nutritional support from a dietitian. I think that's helpful for our patient community to understand as well.
Yeah, and if someone doesn't feel like they would benefit or they don't want to change their diet, I mean, that's also okay. If someone doesn't have any symptoms, but they have a certain diagnosis, then we wouldn't go fishing to change someone's diet. But it's for the people who are struggling, diet can definitely be helpful.
And seeking some type of change with diet change, that would be helpful, right?
Yeah, and then just with the help of a professional, I mean, it's nice because sometimes we find that self-guided elimination diets aren't helpful, and we get to patients who are only eating 5 foods and they're really scared to eat, and that's really tough. So, just trying to support someone where they're at along their journey with finding a diet that works best for them.
Yeah. And then for a lot of patients too that are suffering from GI disorders, they are placed on different types of medications. So I think one thing that we want to know is how might a registered dietitian help patients understand medication and food interactions?
Right, so we don't prescribe any medications, it's not within our scope, but we're definitely a second set of eyes on patients. And so some medications, for example, should be taken with a meal. And they will have less side effects if they're taken at that time. Or some medications work really effectively if they're taken without any food and on an empty stomach. So I catch a lot of that in my clinic if patients are on certain things. So for example, Linzess, right? So you're supposed to take Linzess on an empty stomach at least 30 minutes prior to your first meal. And so that is an important thing that I might ask my patient about. Or another medication, Amitiza, is best taken with food and water or beverage to prevent nausea. Or a proton pump inhibitor, PPI, should be taken at least 30 minutes prior to eating a meal. So those are, food medication interactions, and if not taken properly, the medication might not work as effectively. And then certain medications, sulfasalazine, methotrexate, our patients should be on folic acid because those medications can reduce folate absorption.
Yeah.
So that's important. People who are on corticosteroids are at risk for osteoporosis. So if we know our patients are on those, and you're talking about adequate calcium intake, are you eating enough protein? Is your vitamin D status, within normal limits? So I think those are some things that come to mind thinking about food and medications.
Right. And I think just understanding, just when you should take it, when you shouldn't take it, just really helps patients to understand, okay, this is one medication that I'm on, here's the plan that I got from my registered dietitian, just really helping them understand how to make their medications a little more effective for them.
Yeah, and then it's always good, just as a dietitian, I think to other dietitians, we don't have to know all of the answers for that. So if we don't know, but our patient says something that doesn't seem right, I always circle back to my GI doc. Hey, my patient mentioned this. Does this sound right to you? Do you think that they should have more of this medication? Or, pancreatic enzymes, they might be on a suboptimal dose and it's not working, it's not helping. Or it sounds like somebody might have bile acid diarrhea and maybe they should be trialed on, a specific medication for that. So asking our GI docs or our physician assistants is really helpful.
It's just another way of bringing that whole team back
The team
together.
aspect, yeah, right. It takes a village.
Yep. So this month is actually Gastroparesis Awareness Month, and for a lot of individuals who suffer with gastroparesis, they kind of lose their appetite due to the symptoms. So what are some ways for patients who have a loss of appetite to incorporate food into their diet by maybe working with a dietitian or just on their own?
Yeah, and so that's so hard, right? Not feeling hungry, not having an appetite, or getting sick with eating. I have so much empathy for my patients. And so if it's just a lack of appetite, and I never want my patients to feel like they have to force themselves to eat, but we try to think about and talk about a food as fuel mentality, right? So, food is medicine, and are you taking your medicines as prescribed by your doctor? So yes, so let's talk about trying to prescribe some small meals throughout the day. Not really overwhelm the system, but small frequent meals is kind of the first step with gastroparesis nutrition therapy. And if solid foods are too much or too overwhelming, it might be easier to drink our food or drink our nutrition. So it's talking about, making liquid meals, doing soups or smoothies or shakes or oral supplements or electrolyte beverages or broth. Depending on the person and the severity of their symptoms, but small amounts add up throughout the day. So we don't want to go all day fasting and then try to get all of our nutrition in at the end of the day because it generally doesn't make us feel good. It's kind of this perpetuating cycle. So that's one of the things I would think about if someone didn't have an appetite, and also level of physical activity. So not a personal trainer, not going to tell someone an exact regimen of what to do, but trying to be more active. So if we have GI symptoms, generally we're not as active because we don't feel good, right? Or if it's with a gastroparesis flare. But if someone can get up and do some light walking or moderate walking, that can sometimes also help stimulate appetite.
Oh, that's good to know because it's not really, you don't think about it because you're thinking about food whenever you're losing the appetite, but just knowing that that's just an aspect of probably increasing the appetite just a little bit is good to know too, because I know for me, I didn't know that would also help, so I think that's some helpful information. But I know that we're here at this meeting, so what's what has been, some topics that may have come up throughout the meeting about some new research advancements that may have been made in regards to, just some nutritional support for patients who suffer from GI disorders?
Yeah, so there's been a lot of really good information presented at this conference. And I will say it's rarely one study that changes the way that we practice or like a dietary intervention, but some good emerging concepts. I mean, I really like eosinophilic esophagitis. We heard a lot about that yesterday. I do think one thing that's not super well known is that the allergy tests, like the skin prick and patch tests, are not helpful for identifying EOE triggers. So that's not like breaking news, but I do still find that some centers are doing that, or my patients come to me with lists that say, oh, I've had this guided, allergy test, and that's not really helpful. So it's really the 6-food or 4-food elimination diet. We don't use allergy testing anymore for EOE. And then Dr. Crow spoke about those allergy tests, which I thought was a really nice summary. I wish I didn't bring her slide, but maybe you guys tweeted something out about it.
Yeah, we did.
Which is nice to say that like all these different food intolerance and allergy tests, like the science is not there. We should not be using those to diagnose food allergies. They're not sensitive, they're not specific. I mean, they're so expensive because they're generally out of pocket. So I think that's also really important because those are having a moment right now, I feel like, on the internet. So that would be another thing. And then the FODMAP diet, again, because it's so popular, consistently research is showing that it's best, like to toot my own horn or the dietitian's horn, is this best delivered by a registered dietitian. And so interestingly, a qualitative study came out last month in Nutrients that showed the low FODMAP diet, when administered to people who have IBS or irritable bowel syndrome, it was administered by general practitioners or GI doctors, and it was regarded as too simplistic, the materials. It was regarded as not easy to implement, and so it was just a really interesting study. So I think that kind of reinforces who should be delivering the diet. Yeah, the team aspect. So that's pretty cool.
Yeah, and that's good because that goes into a little bit of us understanding where some of the patients are like, okay, I got some information from my doctor about certain dietary changes. However, it's a little too complex for me to understand, and then just knowing that you have an extra layer and support from a registered dietitian to help you understand some of those changes.
Yeah.
I think that's kind of what you're talking about, and being able to incorporate those changes into your diet.
Yeah.
So I know today at the James W. Freshman Conference, you talked a little bit about what we've kind of been discussing about the village and having a gastroenterologist working in pair with a dietitian. So can you give us a little bit of information about what you talked about today and some of those key points that may be exceptionally beneficial for the patients to hear?
Yeah, so I mean, a lot of it's actually some of the things that we've said. So, I mean, this entire conference is about the importance of nutrition interventions for people who have GI intolerances, sensitivities, chronic disorders. So, nutrition is like prime time, right? Like it's necessary, and patients also want that. They've been asking for a really long time.
Yeah.
So I feel like for the best outcomes, for the best patient experience, which is that's what we're doing, that's why we're all doing what we're doing, is to make people better and help them. Like, it just takes a team. So it takes a GI doctor and a dietitian. Didn't talk about this during our panel today, but sometimes it's also pelvic floor physical therapists, it's GI behavioral psychologists, it's social workers, it's our PAs. It's a lot of people, which is great. And I'm fortunate enough to work in a setting where we have access to all of that. So access to even just a GI dietitian sometimes is hard. So what we're doing at Michigan Medicine to help fix that is putting on a yearly GI nutrition training course. So I know you guys are going to be there again this year. We're going to have more GI on the road, which is going to be great.
Yeah, we're excited about that one.
Yeah, so we're trying to, reach dietitians who have interest in this area, because the interest is there. Like, there's a lot of dietitians who already work in this space and operate in this space, and you guys have a dietitian registry, which is great.
We do have a listing.
Yeah, so it was really just, our discussion was pretty open. We had a lot of Q&A, and coverage is always an issue. We talked about billing codes and creating discounted programs to make our services accessible to everybody, sharing a dietitian within a center. That was kind of the main gist of our...
And just some different options out there of trying to figure out how we can get that for the patient and actually out there for the use of the patient too.
Yeah, and then also there was an interesting comment brought up from a physician in the audience that she's partnering with chefs.
Yeah.
So she's got the chef and dietitian duo going on, and we're starting to do that. So culinary medicine, I feel like, is the kind of
Next
the
step.
next thing. It's already here at some places, but I mean, teaching people actually how to prepare foods versus just telling them what to eat, right? So
It's
cooking.
usually always a question from
Yeah.
patients. I have this dietary plan. Okay, how do I make it at home?
Yeah, I mean, cooking in some areas is a lost art, cooking skills. So teaching people how to make easy to make, affordable meals, right? Not everything has to be specialty products. So keeping it realistic based on someone's family dynamics, food preferences, cultural preferences. There's a lot of things to take into consideration. So yeah, that's also, I think, pretty cool.
That's so exciting. It's really exciting just to hear about, some of the new advances that are coming out and emerging in this whole new era of incorporating diet into with your treatment plan as a patient when you are suffering from GI disorders. I think this is so good to work together as a team with your GI doctor and with a dietitian, and now we're stepping into trying to figure out how we can work with chefs. So thank you everyone for joining us on GI Research on the Road here at the James W. Freshman Conference. And thank you so much, Emily, for sharing your unique insights on how we can work with GI doctors and dietitians and bring that all together into a group. So thank you so much.
Thank you for having me.